and welcome to Gwinnett County Public Library's Surviving the Sandwich Generation Workshop Series. My name is Amy Perry, and I'm an Adult Services Specialist here at the library. Our presenter, Victoria Archibald of Care Patrol, is a certified senior advisor. She will share information about signs to determine when safer housing is needed for older adults and how to choose that best option. Please welcome Victoria.
Thank you. So, as Amy mentioned, I'm Victoria Archibald, and I am a certified senior advisor and owner of Care Patrol of Metro Atlanta. Okay, I must be going in the wrong direction. And tonight, I'm going to talk about surviving the sandwich generation. Now, I found this wonderful image online, and I think it adequately depicts the condition of a lot of adult children who are caring for both their own children as well as their aging parents. The statistics is a little bit old. It's about a decade old, but even in 2012, Pew Research said that about 47% of middle-aged adults were caring for both their aging parents as well as their children. So you can imagine that 10 years later, that number is probably significantly higher. So one of the things that I always chuckle when I'm meeting with many of my clients is, in some cases, it's kind of a struggle, the adult children wanting to get their parents moved into an assisted living community because they see that there is a need there for them to get that extra support. And what I always say to people, even if they haven't started going down that road yet, it's always good to have the talk. And sometimes people don't know when to have the talk. You know, if your parents are doing well and they're still living at home, they may even still be working. They're driving, they have a rich, full life. That's great. That's a good time to have the talk, right? So you don't want it to be a crisis moment where they're in the hospital and the doctors are saying, Mrs. Jones or Mr. Smith can't go home. You want to have it when they are fully engaged and they can participate in the discussion and in the decisions that they want you to help them make. But some of the things that happen as we age, as you know, is the physical and cognitive changes can occur rapidly. Oftentimes, for someone who's a senior, if there is a hospitalization, that can trigger cognitive changes. You know, depending on how healthy they are, there can be episodes where they have to be hospitalized, or they may need some additional support if they're living at home. So starting early, having the conversation about what your parent or grandparent or spouse even would want in the event they are not able to take care of themselves makes it much easier when and if that time comes. So the whole idea of family planning, what do we want to do with mom's, you know, precious mementos, you know, if she has to downsize and move out of her home? What do we do with the you know, china set that she inherited from her mom or her passed down from her, you know, her parent? And then talk about what they want versus what they need. So all of these conversations need to happen sooner versus later, is what we suggest. So actually, what I'm going to pivot to now is just talking about the different options in senior living, because there are several, and it's important to understand what those options are. So the first option is what we call independent living. So really, you know, a lot of people think of the independent living communities as a retirement home, or in some cases, retirement communities. But the way we look at it is, and the way we define it is, it's typically a community of self-sufficient older adults. So they are still very independent. They can get around, they still drive, in some cases they may still work, but they may desire to be in a community and be around other people for socialization, which is so very important as we age. These kinds of communities typically will have 24-hour staff. Now, these are not licensed communities, so they cannot provide any care, any hands-on care. But what they do provide are things like the meals, maintenance, housekeeping, lots of activities for residents to get engaged in, programs, outing, and some transportation. On average, this type of option would cost around $2,700. And usually these communities have studio apartments, one-bedroom apartments, two-bedroom apartments. It's really up to the individual and their budget. The next level of options, this is where you really go from being in an independent setting where care is not offered or not provided to an assisted living setting. In this setting, these communities are licensed by the state of Georgia to provide care for the residents. So here you've got an older adult who still may be somewhat independent, but may need some hands-on assistance with what we call the activities of daily living. So maybe due to a recent illness, they may need assistance with taking a shower, or they may need assistance with grooming or medication management. Those things would be offered in an assisted living community. They would have caregivers that are available 24/7. There would be an emergency response system for the residents. The med techs could help the residents with their medications to make sure those are done properly. And of course, they provide housekeeping and laundry as well. But more hands-on care when we're talking assisted living. In the Atlanta area, you could typically expect to spend around $4,000, $4,300 per month in an assisted living community. And, you know, that's average. So there are places that are less expensive and there are places that are more expensive. Now, within an assisted living community, there usually is a section of that community that's designated for people who have Alzheimer's or dementia, right? So here, what makes the memory care neighborhood, as we call it, different, is that it is secure. Oftentimes when people have dementia or Alzheimer's, one of the factors is they may want to wander away. They may want to leave the building. And so in order to protect them, these sections of the building are secure. They're locked. And again, just like on the assisted living side, they can still support the residents with the activities of daily living. It's just that most of the residents in this instance are going to have a cognitive impairment. And again, this level of care is going to be more expensive because there's more support given. Now, we move from what we call supportive living, right, which is, you know, assisted living, independent living, memory care, to skilled nursing. We've all heard of nursing homes. We've probably had experience with a loved one that had to be in a nursing home, either on a short-term basis or on a long-term basis. So when we get into skilled nursing facilities, it's a totally different level of care. It's a higher level of care than assisted living or memory care, because here you've got nurses and doctors, therapists, nutritionists, social workers that are on call during the day. Nurses and doctors on call 24/7. And again, this is for folks who need a higher level of care. Now, most folks experience a nursing facility because they've had a hospital stay, they may have had surgery, they may have had a stroke, and they're going into skilled nursing on a temporary basis, normally for rehabilitation, physical, occupational, or speech therapy. But in some cases, people are there long-term because they need that level of care, and they don't have support, family that can take them in and provide care. So they live long-term throughout their life in a skilled nursing facility. Because of this being more of a clinical setting, the cost is obviously a lot higher, on average about $8,300 a month. Now that's if you're paying privately. Most people don't pay out of pocket to go into skilled nursing. Most people are going to be on Medicaid. If they're financially or medically qualified, they would be on Medicaid. If they're there short-term for therapy, of course, that comes under Medicare. Okay. Now, respite care is really a program, right? It's designed for people who just want to go into an assisted living community on a temporary basis, anywhere from 14 to 30 days. Typically, this is used as a step down. So maybe someone is getting out of rehab, out of skilled nursing rehab, but they're not quite ready to go back home. So they might choose to go into an assisted living community for a short term. They can still receive physical and occupational therapy, but they're only there for on a short-term basis. They're in a furnished apartment because, again, it's short-term, and they're paying a daily rate somewhere between $150 a day and $300 a day. Another way that this program is used is, let's say you are a full-time caregiver for a spouse or for an aging parent, and you just need a break because caregiving can be really tough. A lot of times families will place their loved one in a community on a respite program for a week or 2 weeks so they can get a break. They can rejuvenate and maybe take a vacation, go visit family or whatever. So this is a program that's available under assisted living. So as I mentioned earlier, we like to accompany our families on tour. When we go look at communities that we've recommended, we are there with you. And while we're there, or if we're not there, these are some general things that we recommend you look for. Obviously, you're going to want to get as much information about each community as possible. You want to experience the environment. What are the residents like? What do they look like? Do they look happy? Do they look healthy? Do they look well cared for? Is the place clean? Are there any odors? Those kinds of things. You want to check out the dining room. I always say, just like you go in a restaurant, there should be a health inspection posted somewhere, even in an assisted living or a senior living community. You go to that dining room, there should be a health inspection posted there. You want to know, are things being done correctly here? You want to look at residents' rooms. What are the living spaces look like? Oftentimes, the larger communities will have what they call a model apartment that's furnished, decorated really well, that you can go and take a look at. You want to understand what are the services that will be provided to my mom or my dad or my spouse or me if I move here. How many caregivers are there? What's the tenure of those caregivers? If my loved one ages, can my loved one age in place? In other words, can they live here through the end of their life, even if their health declines? Those are some questions that we like to ask. And then you want to understand, what are the activities that you engage the residents in? What kind of things do they do on a day-to-day basis? And of course, it's nice to know if they provide any transportation for the residents. So we've talked about the supportive living option. These next two options are more what I would call custodial care. And really the one on the left is truly custodial care. This is in-home care. So this is for folks who are living in their own home, but they need some additional support. Literally, when I drove up this afternoon, I got a call from a family, from a daughter. Her mother just had surgery, discharged home, and she's getting ready to go out of town. Her mother needs someone there with her to provide support in her home, and I'm going to make some referrals for in-home care agencies. So an in-home care agency is going to have a caregiver that will come to the resident, that will help that resident do everything they would get help with if they went into an assisted living, but now they're in their home. Typical cost is between $25 and $30 an hour, and typically they want a minimum of 4 to 5 hours per visit. So that can get to be pretty pricey if you're really looking at 8, 10 hours a day, 7 days a week. And then home health, and before I move over there, in-home care, again, is private pay, right? Home health, though, is covered under Medicare. So in the case of home health, and people oftentimes get these confused, if someone is in a hospital or a skilled nursing facility and they discharge home, or even if they discharge to an assisted living community, the facility or the doctor can write an order for them to receive home health, which means that the physical therapist, the occupational therapist, the speech therapist, the CNA can come into the home. It's not on a regular basis. It's not like 4 or 5 hours a day, 7 days a week. It may be an hour or two or three times a week for a limited amount of time. But again, it's to help that person get back on their feet, and it's covered under Medicare. So there's no out-of-pocket expense. So speaking of Medicare, this next section is just talking a little bit about how to pay for care. Most people don't realize this, but Medicare does not pay for supportive living or assisted living. Medicare is there to pay for hospital visits, skilled rehab visits, or home health, but not assisted living. Medicaid is a federal program that's used for people who are financially limited and can't afford to pay privately for those services. Another source for paying for care is if you have a loved one who's a veteran or a surviving spouse of a veteran that qualifies, and that's the key, they have to qualify. There is a program under the VA called Aid in Attendance. And this is money set aside to support veterans or their surviving spouses to pay for care in an assisted living community, or in some cases, it will also cover the cost of in-home care. So if you have a relative that's a veteran, it's worth checking out to see if they would qualify for any of these resources. So this chart here just talks about what happens, or what is something that could happen that could necessitate a move into an assisted living community or into a nursing home. I was talking to my mom yesterday, and she said that a cousin of ours fell down her steps in her home and broke 2 ribs and is, now in the hospital. Now, I think she will recover and she'll be fine, but falls in seniors is like the 3rd leading cause of injury. It's huge. And so what this just talks about is, if you're involved with your loved one and you're involved with their medical care, you're talking with the doctors, just some things to be aware of. Make sure the doctor's reviewing the medications on at least an annual basis. Make sure they get their eyes checked annually. Exercise to help keep them strong, keep their muscles strong, work on their balance and their gait is so important. And then, of course, making sure the home is set up safe for an aging loved one. Grab bars in the bathrooms. In some cases, if they have stairs in the home, you may want to invest in a stair lift. But whatever can be done to modify that home to make it safe so there aren't risk of falling, that is so very important. Yes, ma'am.
I saw on one of the slides where it said that a person might medically qualify for Medicaid. Do you know what would have to be diagnosed for this person to be medically qualified?
Well, there's medical qualification and there's financial qualification. So the medical qualification would be like if, let's say, it was an elderly person who was living alone and they really had no family support, right? And they were really struggling. Maybe they were starting to have some cognitive impairment, maybe some signs of dementia or Alzheimer's. And they're really not safe living at home. Maybe physically, maybe they're in a wheelchair and they're having problems, we call it ambulating or walking. Maybe they're having problems moving from wheelchair to their bed or bed to wheelchair. Maybe they have a diagnosis that is really, that's best cared for in a skilled environment. I would say, a G-tube, PEG tube, feeding tube, IV antibiotics, or they're having, to have infusions of some kind, and they can't do it themselves. It really has to be pretty chronic conditions, diagnoses that they have, and they are not able to support themselves or help themselves, and there are no family or people that can come alongside them to help them live independently. And of course, if the resources are such that they cannot afford to move into an assisted living community, then of course that would also be a factor. Yeah. Okay, any other questions? Well, I want to thank you so much for, again, braving this weather to come out and listen to the presentation. I hope it was helpful. And again, my information is on the back table. Feel free to reach out to me. I'm happy to have a conversation.
Thank you again, Victoria, for assisting us with these wonderful options that we can look into for our aging parents and loved ones. Again, thank you for joining Gwinnett County Public Library this evening.